Hi everyone, I'm Simone and I'm developing the WEMoS project with Bianca and Tommaso. We are students of Politecnico di Milano. WEMoS is the acronym of Wearable Emotion Monitoring System, and as you can notice from the name, the central core of WEMoS are emotions. Effectively, in addition to profoundly influence our behavior, emotions are a powerful means of communication for all those internalized feelings that cannot be expressed verbally or that are even unconscious. Since mood alteration strongly affects the normal emotional process, emotion recognition is also an ambitious objective in the field of mood disordered psychopathologies. Mood or affective disorders can be classified into three main categories: anxiety disorders, depressive disorders, or bipolar disorders. Several health studies report that anxiety is the most common, affecting 511 million people in the world. 350 million people are affected by depression, more women are affected than men, and finally, bipolarity affects about 60 million people worldwide. Currently, when people start to recognize symptoms of a possible psychological illness, usually they take an appointment with a psychologist or a psychiatrist, who will do a qualitative analysis trying to find the possible causes and remedies of the illness. After that, through psychotherapy sessions and/or the use of antidepressant medication, they try to cure the patient. But with WEMoS, this will change. The core of our project is a wearable network of sensors that will detect, in real time, emotions from the monitoring and analysis of physiological parameters of the patient, such as electrocardiogram, galvanic skin response, electromyogram, body temperature, and face detection. We then elaborate those data in order to identify the mood of the user and if he can have some pathologies. The goal of WEMoS is to perceive in people basic emotion, knowing better those feelings and sensations that usually remain hidden because personal or even unconscious and unexpressible. So, potential disturbs can be detected and cared before they manifest more serious in the future. Data can be used also by psychologists in order to have more information about their patients and elaborate a better diagnosis. Moreover, WEMoS is also composed by a set of lights and speakers that will change light colors and sound of an environment, inducing a better emotional state thanks to data collected. Thank you for your attention, and if you have questions about our project or do you want more information, feel free to contact us. And of course, don't forget to follow us on our social networks in order to never miss an update.